Joining me now is Dr. Annalee Baker. She's an associate professor of emergency medicine at NYU Grossman School of Medicine. Doctor, thanks so much for joining us. This is such a grim milestone. The United States passing 800,000 deaths almost 2 years into the pandemic. But I think what's more remarkable is that 200,000 of those deaths have come after we started to get vaccinated. What does that tell you?
Well, thank you for having me, Vlad. Yes, it's very disturbing. I think none of us imagined that we would ever get to such a terribly high number. And the fact that that many happened after the vaccination rollout is especially tragic, given how preventable many of those deaths were. As far as what it tells me that we continue to be just a couple steps behind this virus. And while the country feels like we're over it, the virus is not over us. We still have a long ways to go. And I think the United States is something like 40th in vaccination rates across the world, which is really inexcusable given that we don't have any issues with supply and that we've improved our distribution and access so much.
Yeah, it's an important point that you make, Doctor. I read an op-ed, a commentary in the Atlantic magazine earlier this week of a man who said that in his part of the country, I believe he was in Michigan, people are carrying on as if the pandemic is over. No one is masking. People are gathering in large crowds. And, the question, of course, becomes if that is how people are going to behave. And I understand, and I think we all understand, that people are COVID tired. I mean, even this week, I was on a flight back. I was, traveling for work, and I was on a flight, and I was wearing my mask, and it just started to hurt my ears, and I just had a thought to myself, like, man, I can't wait to get rid of these masks, right? You don't want to have to wear a mask everywhere you go. But the danger is not just asymptomatic spread, that people who are vaccinated can still be infected with COVID-19 and spread it to people who are vulnerable, but also the rise of these variants. And I think that's, you said something interesting. We may be done with COVID, people may be tired of it, and people understand that, but the virus is not done with us.
Yeah, that's absolutely right. We definitely see regional variations in the response, and it's interesting. I don't do a ton of traveling, but I've noticed the same thing. Depending where you go, where we are in New York, in this area, people are still fairly vigilant. I think because of the trauma that it's still fresh in people's minds from being the first to experience the surge. But even here, we see people becoming more lax. And even in the hospital, we're seeing breakthrough infections, even among people who are being vigilant. So that's what's so scary about this Omicron variant, that appears to be so much more contagious than prior variants.
And so does that mean, and this is I have no understanding of biology or medicine at all. I did not do very well in my biology class in high school, but because you still have a significant number of people that are unvaccinated in this country, and understanding that 200 million have been vaccinated, but there's still a lot of people who are not. The fact that this virus can bounce between vaccinated individuals and unvaccinated individuals, and of course it's still circulating all around the world, that is what in some instances can lead to rise of variants that are resistant to those of us who are vaccinated and boosted.
Well, that's right. And it's a complex process when a virus evolves. Typically the virus, of course, is not sentient, but the evolutionary pressures on the virus are really pretty much aimed at a virus that wants to continue existing and continuing to spread. And that's why we're seeing these variants like Omicron, which are so much more contagious. Now, the early data does appear that it's potentially less virulent, meaning less serious disease, but that doesn't mean that we should take it less seriously, because given that it appears to double, at least in the UK, I think we're seeing doubling rates every 2 to 3 days, which is tremendously faster than any of the previous variants, it could still easily overwhelm the health system. If your family member or you are in the hospital with a heart attack or a stroke, you certainly don't want to be waiting hours to be seen or not able to find a bed.
So that sort of leads to my question about what these South African researchers have discovered, which is that 2 shots of the Pfizer vaccine is only 33% protective against Omicron, although it is 70% protective against hospitalizations. But I don't know, should we look at the glass half full or half empty when you hear these kind of results? I mean, 70% is pretty good, but before the rise of Omicron, we were told that the chances of ending in a hospital or on a ventilator if you've been double vaccinated are pretty low.
I do think it's positive that number one, that it's still preventing a lot of hospitalization and death. Number two, that the boosters are so effective. So, that there was the South African study, and then of course the data that came out of Pfizer, and both of them seem to indicate that the booster really significantly re-upped the ability of the body to fight the infection at all, and also to prevent hospitalization and death. So I think the message and the take home is that number one, we need to get all those unvaccinated people shots in arms one way or another. And also that anybody who's eligible for a booster in an area where it's available should consider taking the booster if they're 6 months out from their initial series.
It's good advice, Dr. Baker. We have been, of course, sharing your advice and other medical professionals' advices on our air for the last, 2 years practically. And I guess we'll keep doing that until people understand how vitally important it is. Thank you very much, Dr. Baker.
Thank you for having me.